Today I'm talking to Dr. Tom Cowan about a wide-ranging set of topics. We've already been having a little bit of a conversation before I hit record, and it's going to be something that is the opposite of what I frankly am used to talking to people about, in the sense that Dr. Cowan has looked for the data and research supporting many claims made in medicine. And he's telling me that a lot of these claims that are made just don't exist. And I'm curious to learn about his approach, about his ideas, and how it can help improve patient outcomes, which is always for me the focus. So, Dr. Cowan, thank you for being here, and I look forward to an interesting conversation.
Thanks. And two things, you can call me Tom.
Thank you.
And I just to say something about what you said, the claim exists. You said the claim doesn't exist. The claim exists. It's just not validated.
Okay.
That there's a difference there.
Okay, so let's talk about that. Let's talk about a couple of claims that you think that you've concluded are not validated, that are commonly understood, commonly accepted in medicine and by the general public.
So let's just go through, if you're okay, some fundamental points of logic, because I want to see if you agree with this, because I think that'll put us on a good foundation, if that's okay with
Sounds
you.
great.
So one of them is so we're talking really about science here, and I would say one of the foundations of science is there's a claim that's made, and if the claim can't be falsified, then it's by definition a belief and not science. So, for instance, if somebody says the earth was created in 7 days, I don't know how you falsify that claim. And I don't frankly know whether it's true or not. And so that's a belief system. Would you
Okay.
agree with that?
Yeah, if we're talking about the strict definition of research and the null hypothesis that is
Right,
posited when somebody is creating a research study, that is the definition of the scientific method in terms of creating research.
right. So that's the first. The other is science is not about competing theories. It's about falsifying claims. So the example that I like to use for that is if, let's say, you're an 18-year-old Asian fella and your parents are Caucasian, and then you find adoption papers in your mother's closet, and you go to your parents and say, "Is this true? I was adopted." And they say, "Yes, we got you from an orphanage in China, and we were waiting to tell you," etc. So then you go to your best friend and you say, "I just found out I was adopted. I was a little shaken up." And he says to you, "So who are your real parents?" And you say, "I don't know. I just found out I was adopted from China somewhere. I may never find out." And he says, "Until you tell me who your real parents are, I don't believe you were adopted." Uh, I think that's a anti-scientific approach. And the reason I point this out is because one of the claims that I think we may want to talk about is there's a claim that there are entities called viruses, which are physical entities, and they cause diseases like chickenpox. So when I say to people there is no evidence that there is such a thing called a virus, and then immediately they typically say, "So what causes chickenpox?" Which is like saying, in order for me to know to show that I was adopted, I have to tell you who my real parents are. And I would claim that that is a anti-scientific, illogical way to think.
Okay. So, in terms of the chickenpox idea, do you subscribe to the concept that a physical agent, a physical thing, whatever you want to call it, causes disease and outside of our body? For example, you and I agreed that bacteria exists. And so, with respect to viruses and chickenpox, do you believe, or have you concluded that there is a disease, a suite of symptoms that we call chickenpox, and it is caused by something that is interacting with our body? And I'm going to say immune system, but I know you already said we don't have an immune system. Unless I'm
Oops.
mischaracterizing you.
Let's change that. Let's find the claim here.
Okay.
The claim is that chickenpox or measles or smallpox or Fifth's disease or the flu are specific biological entities called diseases, and they all have a specific physical particle called a virus. A virus has a certain definition, which is a obligate intracellular parasite that has a protein coat and it has either DNA or RNA in the interior. It uses the cellular machinery to reproduce, and in that process, essentially deteriorates the cellular environment, and that's how it causes disease. That's the claim, right? You agree with that?
Yes, and I'm also, I think, jumping ahead a little bit. I believe there are studies that have been done with isolated influenza A or B viruses, and people have been given them, and they then have developed the symptoms of
So
those
tell me how
diseases.
they isolated the influenza virus.
I don't know. I don't know. I'd
So
have
that's
to.
the interesting thing about this, and not to be antagonistic here, but I ask people, so okay, let's talk about this isolation phenomena. So if somebody wants to say, there are hammers and hammers knock in nails, right? Very simple. There's a physical thing called a hammer, and hammers knock in nails. So, how do you demonstrate that claim? First of all, you give a definition of what a hammer is, and then you go to the ecosystem where you would expect to find it, like a toolbox. And then you physically separate the hammer from the toolbox, and you have only the hammer. That's called the isolation of the hammer, i.e., the separation of the hammer from everything else. Right? You with me?
Yeah.
Then you hit the nail with the hammer. And if the nail goes in, you say it's the hammer that made the nail go in. And then you might do this with your hand to see if it was just the movement of your hand. You might even think a nail go in, and you've done therefore controls, and you've isolated the causative factor, which is the reason the nail goes in is because you hit it with an isolated hammer.
So let me just ask you this then, because I've not read those studies about the inoculation with influenza A or even other viruses. And so for you to ask me, how did they isolate it? I'm not an expert in that. I would turn to the research to try and read about that and figure it out. Uh, to call immunologists to talk to them, virologists to see if they know. So you've looked at this. You're claiming that a virus doesn't exist, and you are at least.
No, that's not true. I'm claiming that the evidence that they use to show that it does exist is invalid.
So in the study, then, do we both agree that there are studies that have been done where they took what they claimed was, at least in the study, isolated influenza virus and inoculated people and produced those symptoms? Or other viruses, other diseases? That has been the claim that has been made in studies.
Of course, there's 10,000 at least
Okay.
claims. So let me go through one of them.
Yeah. Well,
But
where I'm getting at is, can you tell me the process by which in the studies, in one of the studies, then, where they claim to have isolated the virus, what they did, what the methodology was, and why you were saying that actually is not, as I'm understanding it. Again, I don't want to mischaracterize you, that is not actually an accurate um, isolation of the virus. They did not isolate the virus.
right, but I think the more important thing, since I've done this probably 500 times publicly is to get you to see if you agree. So, for instance, and that's why I use the hammer, because if I said to you, I can prove, John, that hammers knock in nails, and I go to a toolbox and I don't look to see if there's a hammer in there. I don't know if there's a hammer in there. And I hit the nail with the toolbox. And then I claim that that proves that hammers knock in nails. What would you say to that?
So my first question is, it sounds like you're talking about a clinical trial, a design clinical trial. There are different.
Why don't you answer my question?
Well, I'm trying to, but I'm trying to understand because there are different scientific studies that are done. There's epidemiological data. There are controlled clinical trials and experiments. So within a controlled clinical trial experiment, I would agree with you if we're talking about the concept of a hammer and a nail. That if you're looking to isolate the individual variables that could determine whether a hammer does not exist, then I agree with you.
Okay. So, in order to have a study, you have to have a dependent variable and an independent variable, right?
Yes.
Okay. So let's go through the one of the original examples of the isolation of a virus and the proof that it causes disease. And let's compare this with the hammer and the toolbox. So that's polio. Polio was first isolated in 1908 in a very important paper. And the way they did that was they took the anterior spinal tissue of a child who died with paralysis. So that's what they said was polio. Even though, of course, there are other reasons why children have paralysis. So they had no way of knowing that it was actually polio. So they took the spinal cord that was obviously diseased, they ground it up with some fluid like saline and some other chemicals that had buffers in it. They filtered it just to get the big debris out, like cells. They put that in a 10 cc syringe and they injected it into the brain of two different monkeys. And one monkey got paralyzed and one monkey died. And they said, A, they isolated a polio virus, and B, they showed that it was the causative agent.
Okay.
What do you think of that?
Well, I think that it was an old study done using the technology that they had at the time. I think that there obviously are limits at any period of time about what we are technologically able to do or not do. And it's that isolating down to one independent variable and one dependent variable. The answer is no, it's not. There
So, in
are
other words, that didn't prove A, there was a polio virus.
that's correct.
Okay,
That's
that's
correct.
correct. So
So
that study, even though it's one of those 10,000 studies I mentioned, called the isolation of a virus, in fact, did not isolate the virus.
so how then, let me ask you this, based on that research and other research, there is now the polio vaccine. Do you think in your conclusion and looking at the research that the polio vaccine is a isolated polio virus, the attenuated virus that's in some of the vaccines, and that B, it is actually preventing the development of polio?
So tell me how they make a polio vaccine.
I would prefer if you would answer my question because you've done the research. I haven't. So for you to ask me these technical questions, I believe is unfair because you know the answers to them. I believe. I think you probably have a pretty good sense because you've done this so many times of asking somebody who's not an expert in this, who has not spent so much time, these very technical questions. To me, I think, frankly, is unfair because, of course, I don't know the answer to that, and I'm trying to understand where you're coming from and what the extension with clinical medicine is with this. And if you were saying that they never verified a polio that polio is the causative agent of, or what we call polio virus is the causative agent of what we call polio. And then I'm curious to know about the vaccine then. And do you think that, my question based on that, I am just curious to understand how this plays out clinically. So is your
So
conclusion?
here's how. So let's go to that question then. So for about 43, 46 years, the only way they isolated a polio virus was by injecting unpurified diseased material, never having found any particle that could be called a virus, into the brains of various monkeys. Some estimate 100,000 monkeys. And then in 1953, which is an important date in this story, some guy, and I don't remember his name, wrote a paper saying he decided to inject the healthy brain, healthy spine into the brains of some monkeys. And what he got was they got paralyzed or died as well. And he said that this proves that injecting diseased spinal tissue does not prove the isolation of the virus or that that the disease is caused by a virus or the death of the monkeys, because the monkeys die anyways, even with healthy spine. Apparently, monkeys don't like injection of 10 cc's of healthy spinal tissue into their brain. So that was the end of that technique for doing isolation. Now, the reason that's an important date is in 1954, a guy named John Enders got a Nobel Prize, not exactly for this study, but for the general theme of things, for developing the technique which is still used in every single isolation study since 1954. Let me say that again. Every isolation study that you referred to, of which there's probably 10,000 in the medical literature, have used this exact same technique that Enders inaugurated in 1954. Now, he did it with the measles, but it was also done at the same time with polio. So what Enders did is he took the mucus from a child who allegedly had measles. He, again, didn't look for a virus in it, didn't look for a particle in it. He filtered it to get the dead cells and the debris out. He mixed it with a bunch of chemicals like trypsin, and then he inoculated that onto a growing culture of monkey kidney cells. He also put horse serum and fetal bovine serum into the growing cells, and then he took away the nutrient broth. He reduced the nutrients of the cells, and he added two antibiotics, streptomycin and penicillin, both of which are known to be toxic to growing monkey kidney cells. And then he waited for about 4 days, and the growing monkey kidney cells died, which is called the cytopathic effect, the cell death. And he said that proves the isolation of the measles virus or the polio virus and shows that the measles virus is the causative agent in the death of those cells. Now, interestingly, and I can read you the paper if you want, and again, this is the same technique that is called the viral culture. That is called the isolation of the virus right up until 2025 with SARS-CoV-2. Every influenza virus, every measles virus, every polio virus, every smallpox virus, every Ebola virus has been isolated the same way. Now, interestingly, Enders in that paper did the entire experiment, the fetal bovine serum, the horse serum, the calf serum, the trypsin, the reducing the nutrients, the antibiotics. He did the same thing with the monkey kidney cells, except he didn't add anything from anybody with measles, right?
Okay.
And you know what happened? The cells died in the exact same way. He said the results were indistinguishable. Interestingly, then they did electron microscopy so they could see the particles that were coming out of this broken down cell culture. And he identified, and others since then have identified particles, which they say those are the viruses. But there's at least 20 studies in the medical literature, and I have a whole slideshow on this, where they got the exact same pictures from the uninoculated culture. And we now know that when you break down monkey kidney cells and when you put fetal bovine serum into the brew, which they do in every single isolation experiment, that you get identical particles.
So again, my jump to the clinical applications of all of this. So is it fair to conclude then the entire foundation upon which the um, immunization campaigns in globally really are on a false premise?
Correct. Now let's get into you. You asked what about the polio vaccine? So again, the reason I ask people who ask me questions is because they have a belief system that the polio vaccines, we're told, here's the claim, wiped out polio. Now, let's say, what is a polio vaccine? Now, interestingly, most of the people who believe in that claim, when I ask them, so tell me how they make a polio vaccine and show, first of all, we now know that nobody has ever isolated a polio virus because what I just told you was they disproved that the cytopathic effect, which is to this day, I can't emphasize that enough, is the only way that a virus has ever been isolated. We have 220 Freedom of Information responses from the CDC and the Robert Koch Institute and the NIH and Louis Pasteur, blah, 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 and the Canadian health thing, asking them, have you ever isolated a virus, a particle that you say is a virus, directly from any fluid of any sick animal, human, or plant? And they say, no, that has never been done. So there is nobody who ever took a chicken pox blister, who ever took a measles snot, or ever took the blood from somebody with quote Ebola and looked at it and purified out a particle which could be called a virus from any of those fluids. And every single virologist and health authority agrees with that.
That's unbelievable. I mean, that's incredible to hear and
And
learn.
it
That's definitely nothing I
absolutely
ever learned.
right. And I will tell you, John, that if you can show me one paper where that's not true, what I just said, I will come back on your show and say I got it wrong.
So
Because we know there is no paper that does that. And the virologists categorically say you cannot isolate and demonstrate this particle directly from any fluid or tissue of anybody who's sick.
okay, so again, back to the clinical applications of immunizations, regardless of the question whether or not it's isolated, attenuated polio virus, whether it's influenza A or B, whether it's totally isolated or not. I'd love to hear your perspective on the immunization campaigns that exist. I mean, the CDC schedule I think is ridiculous, but in terms of have immunizations, whatever, despite the fact that you're saying there is no isolated, just pure isolated virus in there,
There is no demonstration of the existence of a virus because what I just told you is how they do it.
Okay, so given that, and given that people do get immunized, so I guess my first question to you is, since you understand this body of knowledge and you've researched this, do you recommend people do not get immunizations?
So let's go through what a polio virus is, a live virus vaccine, polio or measles or mumps. And then you mentioned an attenuated virus
So
vaccine.
can I just redirect this if this is okay with you? The details are fascinating, and of course, I'm just talking about immunizations, whatever's in them, whatever happens to be in them, whatever they claim is in there, whether the claim is correct, whether it's not correct. Do you, um, in terms of the research, if you looked at this, is there support for immunizations preventing the development of what we call these diseases? Whether it's on a false premise or not, I'm just curious that just a very basic level of
See,
preventing
that
these.
that is a very superficial, excuse me, question, which is because I would much rather people understand how a measles live viral vaccine or a live polio
Absolutely, but can't we do
comes
both? But
about.
can't we do both? Can't we answer both questions? So
Once you understand
so
how you get a vaccine,
our brains work different, come at this at different directions. I start at the level of what I just said, and then I work backwards to understand. It sounds like you're starting where you wanted to talk about and will get me to my question. And so I'm happy to follow your lead on that, but I'm just telling you, it's just the way my brain works. I do want to understand what you're saying, but I sort of jump to the punchline for me, which is the clinical application, and
but
then I want to understand it backwards. So you go ahead and you tell me how you sort of fill me in and walk me through this however you think is best from your perspective.
okay, polio vaccine, measles vaccine, the measles vaccine, they take the snot from somebody they allege has a specific disease called measles. By the way, it's just to say the CDC says and has a number of studies proving that no clinician, no experienced pediatrician can positively identify a case of measles compared to chicken pox and German measles and fifth disease and roseola and a whole lot of things by examining or hearing the symptoms. That's what they say. And so they say you have to confirm that with a molecular diagnostic test, which only was available since like the 1990s, which therefore means we have no idea who had measles and who didn't before 1990, according to the CDC, because you can't tell, and they've proven that with a number of studies. So, first of all, we don't know that this child actually had measles or not because we didn't confirm it because they didn't have the test to confirm it. Anyway, so what they
Great
do,
point.
they take the snot, they again don't look for a virus because they know they can't find it. They put that on a monkey kidney cell, the antibiotics, the chemicals, it breaks down. They put that in a vial. That is a live viral vaccine. Nobody ever found the virus in there. And then when they want an attenuated vaccine, they take some of the proteins out of that brew and claim that is an attenuated vaccine. And then they inject it into the children or people and say that it prevents them from getting a certain disease. Now, it's different with different diseases like polio. What they did the same thing. They took the diseased tissue, put it on a monkey kidney cells. It broke down. You get a brew. They call that a live viral vaccine. They inject it into children with polio to prevent polio. Now, at the same time, they did some other tricks, which is before the vaccine rollout, if you had acute symptoms and paralysis for even a day, that was called polio. And after the vaccine rollout, which was poisonous to a lot of children. They changed the definition so you had to be paralyzed for up to 6 months. And that eliminated about 95, 97% of the cases because most of the people would recover on their own. It was at the same time where two other chemicals, which are known to be neurotoxic to the anterior horn cells of the nervous system, exactly the place where the polio virus is allegedly to affect. One was DDT, and the other was lead arsenic sprayed all over the fruit trees. They were basically eliminated from our armamentarium in the ecosystem. So for those two reasons, you have a decrease in the incidence. And then you still had somebody who died, who had an acute illness and then paralysis, they changed the name. So it used to be polio, and now, like in India, they had last 5 or so years, 300,000 cases of acute flaccid paralysis. What is acute flaccid paralysis? It's an acute illness like a cold or diarrhea, followed by paralysis, which used to be the definition of polio. But since they started the vaccine and they supposedly wiped out polio, now they call it acute flaccid paralysis. In the United States, we have something called Guillain-Barré syndrome. What is that? It's an acute illness followed by paralysis. Thousands of cases a year. That is exactly the definition of what they used to call polio. So there's a number of ways where they manipulate the perceptions of the people. One, there's no virus. B, you can tell that because they've never isolated the virus, and the way that what they're injecting in you has never even been found a virus in there. B, so they've never proven the disease is caused by a virus. So there's no way to say that protecting you against a virus, which they have never found, could do you any good. The
So,
next thing is
so
they changed the definition of the disease, so it makes it seem like the old one is gone and now they have a new one, same symptoms, and so we're good.
okay,
That's how they do it.
so back to the clinical question of the claim that immunizations prevent disease. My understanding from what you've just said is that cannot be proven or disproven because the entire premise that this virus causes this disease and the disease definition is changing is that it's always a moving target. And so it cannot be proven or disproven. Am I understanding that correctly?
No, the claim is that polio vaccines have eliminated or dramatically decreased the incidence of polio, and that has been disproven.
Okay. So can you
Same with
succinctly?
measles, same with influenza, same with all of them.
Okay. So
And
very
there's another factor that you have that has to be entered into this, which is we have an erroneous and I would say naive conception of what illness is in the first place. And the way that I describe that to people is if you get a splinter in your finger and then you don't take it out, what happens next? And I know you don't like to answer questions, but what happens is you get pus and redness and sometimes pain. And then I ask people, so is the pus and the redness, is that an infection? Is that the disease? Or is that your body's way of getting out the splinter? And most rational people say that is your body's therapeutic response to a foreign body getting in your body, right? You make a response to get it out. Now, that's easy to see with a splinter, but what about if you breathe in debris in your lungs? So there's all kinds of toxic debris in the area, and then you get a cough, right? Mucus, and cough and you feel bad and a fever to liquefy the mucus. That's like the redness and the pus with the splinter. That's your body's way of getting out the debris. But unfortunately, you go to the doctor and he says you have a disease called bronchitis, so I'm going to give you a medicine to stop it. And then you're left with debris in your lungs. And then they do that twice a year, and then you get chronic lung disease. Now, that's why when you give somebody these injections of toxic material, otherwise known as a vaccine, what happens is you change their symptom picture from harmless elimination of debris, which is what chickenpox and measles and all the rest of them actually are. They're not specific diseases. And you change that so that now the person is chronically sick, which is exactly what happens in every culture, every society that adopts the vaccine program, is you start seeing a dramatic increase in chronically sick children who, because their ability to detoxify and get rid of their debris is thwarted with these otherwise toxic products,
Yeah.
and they're left sicker than ever.
But isn't it true that to prove that conclusion that you've come to, you would need to isolate, like we started, a dependent and independent variable. And there are many independent variables in that scenario when you're talking about, years and years of people's lives and them being sick or not. I'm just curious how you isolate that. And you're obviously very methodical in your thinking and incredibly well educated and studied in this. So how do you isolate, that claim, that conclusion that it is because of the vaccines that there are these chronic illnesses? If I'm understanding you correctly, I would just curious to know how you come to that conclusion that it is because of that's the causative factor.
Yeah, I mean that's a good point, and there are that it is a tough study to do that. So I would say that is a working hypothesis that I use to explain to people, well, we don't see children with these acute rashes anymore. That's because when you treat somebody with an acute rash by suppressing their symptoms, and you can do that with steroids, you can do it with antibiotics, you can do it with vaccines, they don't suddenly become healthy. They change their disease pattern. And that's something we see in every culture, everybody who adopts this way of thinking, which is basically the body has been invaded and the response of your body is to be thwarted.
So you mentioned antibiotics, which only kill bacteria. And before we were talking about virus, I just want to be clear for people listening. So are you saying also if somebody has, for example, pneumonia caused by an antibiotic and caused by a bacteria that is progressing and they're having labored breathing and perhaps they're getting fluid in their lungs, are you suggesting they should not be treated by an antibiotic?
So let's go through that claim. And I know you don't like me to ask you questions, but isn't it true, or do you agree, that in order to say that a bacteria caused pneumonia, right? That's what you claimed just a minute ago. In order to do that, you would have to isolate the bacteria, which you can do, right? Bacteria are clearly living, existing entities, which are easy to isolate, just like a hammer. And then you give that to a bunch of well people or well animals, and you recreate the illness. That's basically called Koch's postulates, which are supposedly the foundational way of thinking of infectious disease and modern medicine, right? So you isolate the bacteria, you find the bacteria only in the sick people, not in the well people. You isolate the bacteria, give that only the bacteria, and you cause disease in the well people. I can tell you, John, there is not one study in the medical scientific literature that shows that an isolated bacteria has ever made anybody sick. And if you disagree, I'm going to have to see the study
I don't, I
because
don't,
I know it doesn't
I
exist.
don't disagree, but I also don't know how those studies were conducted because typically everybody,
Simple. You take an
everybody,
isolated bacteria.
everybody, everybody is always exposed to bacteria and viruses in our environment, but not everybody gets sick. I mean, you and I talked before we started recording. I called it the terrain
How do you
theory.
know they're exposed to viruses?
So, okay, it is a belief system. So let me ask you this. Let me go back to my clinical question then, because this is a
So,
real life.
John, isn't it true that the way you would prove that a bacteria causes disease is you t simply take only bacteria and expose healthy people to them and see if they get sick?
I would say you need to expose people who are maybe worn down, who are not rested, who have their again, this is getting into, I believe, a conversation where you can say, well, we don't have an immune system, but I would say, who's colloquially speaking, whose immune system is compromised, where they are more susceptible. At least this is the explanation in medicine, more susceptible to getting having symptoms develop from that bacteria. But
So
back to
a isolated bacteria has never made anybody sick.
okay. I will believe you on that. I have no data or information to say otherwise. That's so I
I
guess.
I do because I've looked
No,
for
I'm sure
five.
you do. I'm sure you do. I'm not here to debate you on this at all. I'm sure you do. I defer to you on that. You are the expert in this, not me. But back to my question, because this is a clinically relevant question, and that's I try and bring it back to people's everyday clinical lives. If somebody is diagnosed, for example, with pneumonia, and their doctor says, "I want to give you an antibiotic," are you? I'm just curious to know what you're a physician, what your and who is an expert in this, what your recommendation is. Do you recommend and say, no, do not take antibiotics? They do not work. Or I'm just curious, how do you approach somebody who has, for example, pneumonia that's progressing? How would you, as a
I mean, it's
clinician,
it's so
given what
it's
you
so
know?
curious here, John, that and you've mentioned this, that your first step isn't to try to understand. So if bacteria are not the causative agent, which we've disproven, then what are they doing there?
So that's what I'm
In other
asking.
words,
So that's what I'm
they
asking you
are
clinically.
there.
So clinically, from a case, let's just take this, if you don't mind, from a clinical case perspective. If you have somebody who's coming
But
to you,
here's the thing, John, I do mind. The
okay,
reason I mind is because you're essentially determined not to understand what a bacteria is actually doing there.
oh no, I'm happy to understand that. I no no no.
Why wouldn't you do that first? And then if you're confronted with somebody who allegedly has this disease, and you've already determined that it's not caused by a bacteria, that would lead you to a whole different approach
Okay, can
than
we
if.
just put the bacteria question aside then? So can we just say that somebody is coming to you with symptoms that are commonly understood to indicate pneumonia, and maybe they have a chest X-ray with a line on it that and maybe that definition, that even diagnostic definition, is not um, something that you believe or you've concluded is even relevant to any of this. So I really want to understand this paradigm. I really want to understand how you would approach somebody with symptoms of labored breathing, rails, the common symptoms that we all are taught indicate a pulmonary infection. Now, that's obviously, I'm coming from a very conventional diagnostic point of view. If you're saying that is totally the wrong way to look at it, how do we then improve their breathing? How do we improve this? That's really what I'm just trying to understand. And if you don't want to talk about that, if you want to go back to what is a bacteria and all that, and maybe that's all part of it, I totally respect that. I'm just trying to wrap my head around clinically, how does this get applied? And
So I would say 37 years, I probably treated thousands of people with pneumonia, so-called pneumonia.
Yep.
Pneumonia. So I mean, it's really interesting that you're trying to do this without understanding what the process is of that a person is going through. They're coughing out debris. That's how I saw it. So I introduced things into them that would help their body eliminate these debris that was in their lungs. And I would say in 37 years, maybe I needed to treat 5 people with antibiotics.
And so what sort of things
Everybody else was alive and well.
and what sort of things do you introduce to increase that elimination?
There's all kinds of
Just
things.
examples. I mean, I'm not looking for an exhaustive
Mustard
list.
compresses on the chest.
Yep, I was taught that in school. Yep.
No. I would have them breathe in turpentine or eucalyptus steam. I would use something like chlorine dioxide or mucolytic herbs. The point is that bacteria grow when there's dead and dying tissue. It's not that they're not there. And to say that they're the cause is akin to saying, well, I see firemen at fires, therefore they're the cause of the fires. It's the same level of sophistication that has led people to think that bacteria cause disease. Because if anybody is logical and rational and scientific, they would do what I said, expose healthy people to bacteria and show that it doesn't cause disease. Period. That claim has been falsified. In nature, it's easy to see bacteria and fungus, which also exist, and which are pleomorphic, actually, which has been demonstrated, which means bacteria are not like unique species. They transform themselves into fungus, into different types of bacteria. That has been verified and seen. And so if you have dead and dying tissue in your lungs, and that could be for a whole lot of reason, just like if you have dead and dying trees in your forest, the bacteria and the fungus will start to grow. Why are they doing that? They're doing it to help remediate the situation. If you get rid of the dead and dying tissue, which is what mustard compresses and chlorine dioxide and all these old natural medicine things, Chinese medicine, Ayurvedic medicine, they all had variations of the same thing.
Naturopathic medicine. These are all things I was taught in school.
They do the same thing, which is to get rid of the dead and dying tissue. Then the bacteria naturally don't have anything to do and they go away. And you almost never have to kill the bacteria. Like I said, probably 5 times in 37 years. And nobody died of pneumonia. Nobody died of urine infections. Nobody died of cellulitis. It's because if you don't understand the underlying process, you're always treating the body's solution. You're treating the body's solution, and then you make up these reification fallacies and call it an immune system or whatever. But what you're doing is treating the pus, which is there to get the splinter out.
You're treating the
And
symptom and not the underlying cause.
it's not the symptom, it's the strategy of the body to get you well.
I,
That is the key important point. The pus is there to get the splinter out, and everybody can see that because that's what it does, and then you go back to normal.
yeah, but can't both be true? I mean, I was using that symptom as exactly what you're talking about. Can a symptom just be the body's reaction to trying to get back to normal?
It is the therapeutic response.
Got it. This has been fascinating. How can people find out more about your work? They can learn more, and possibly even, I know you have a clinic that you've created where people can get help using your approaches. Tell us how they can learn more.
So the main website is drtomcowan.com, and if you don't want to be treated by doctors using disproven hypotheses, we started an online new biology clinic, newbiologyclinic.com. And our doctors treat people based on actually why they get sick and how they get better.
Thank you so much. Thank you for your time. I appreciate it.